Do you have any second thoughts about your mitigation recommendations, considering the evidence that despite all of the things we've done in the U.S., our death rate is essentially worse than Sweden, equivalent to the less developed world that is unable to do any of the things that you've been promoting? Do you have any second thoughts? Are you willing to look at the data that countries that did very little actually have a lower death rate than the United States?
I don't regret saying that the only way we could have really stopped the explosion of infection was by essentially, I want to say shutting down, I mean essentially having the physical separation and the kinds of recommendations that we've made.
But you've been a big fan of Cuomo and the shutdown in New York. You've lauded New York for their policy. New York had the highest death rate in the world. How could we possibly be jumping up and down and saying, oh, Governor Cuomo did a great job? He had the worst death rate in the world.
No, you misconstrued that, Senator, and you've done that repetitively in the past. They got hit very badly. They've made some mistakes. Right now, if you look at what's going on right now, the things that are going on in New York to get their test positivity 1% or less is because they are looking at the guidelines that we have put together from the task force of the 4 or 5 things of masks, social distancing, outdoors more than indoors, avoiding crowds, and washing hands.
Or they've developed enough community immunity that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.